Hey everyone, I'm your host Adrian. We do content like this weekly, so hit the subscribe button and ring the bell to get notified. If you want more content like this, click the like button and please leave a comment. Thanks again for watching. Thank you so much everyone for joining this afternoon, and welcome to today's very special live class presented by the all-new Rupa University, the best way to learn about specialty lab work from industry experts. My name is Adrian Martinez, and per usual, I'll be your host for this afternoon. Today, we have a very, very special guest in Dr. Carrie Jones, Head of Medical Education here at Rupa Health, here to give us a masterclass on the Rupa Health platform. Before jumping in, a couple of quick housekeeping items to go over. Everyone joining will be muted by default, but if you have any questions, which we hope you do, please feel free to use that Q&A button down at the bottom of your menu bar, and we will host a live Q&A session at the end of the presentation. Immediately following the Q&A, I should have probably take this part out. We don't have to go through Rupa Health because Carrie is going to give us a masterclass on Rupa Health. But if you do have to jump early, no worries at all. We are recording this session and we'll be uploading it into the Rupa Health or the Rupa University platform, which Carrie will go a little bit deeper into throughout the presentation within the next couple of days. But with that, let's jump in. I'd like to introduce you all to Dr. Carrie Jones. Dr. Jones is an internationally recognized speaker, consultant, and educator on the topic of women's health and hormones. She graduated from the National University of Natural Medicine in Portland, where she also completed a 2-year residency in women's health, hormones, and endocrinology. Later, she graduated from Grand Canyon University's Master of Public Health program. She was one of the first to become board certified through the American Board of Naturopathic Endocrinology and currently serves on that board. She was the medical director for the Dutch test for several years, and she's on the Under Armour Council on Human Performance. And as I mentioned, in my opinion, most importantly, she is currently the head of medical education at Rupa Health. Carrie, thank you so much for joining us, and I will go ahead and pass the reins over to you.
Wonderful. Oh my goodness. Thank you, Adrian. I'm really excited to be here today to talk to everybody about this lab ordering masterclass. So the reason that I'm so excited about this is, in fact, this really hits close to home. I was just talking with somebody at a medical school who's high up in academia in the medical school. And I said, tell me about how your students order labs. Tell me how they learn about lab work. And she said, well, actually, we serve a fair number of Medicare patients. And as a result, the Medicare patients, if it's not covered by Medicare, then they don't have a lot of experience with labs, specifically specialty labs. So when they graduate, they actually don't know. They actually don't know how to order specialty labs or how to re-evaluate specialty labs. And even some of the typical blood draw labs, they may not order because the large majority of our population around their clinics and hospitals and stuff for Medicare. And so I thought that was very apropos to what we're talking about today, because a number of you maybe have recently graduated, you're new to practicing, and you actually don't know how to order lab work, or it seems overwhelming, or maybe you've been a practitioner for many, many years and you are transitioning into functional medicine and learning how to get into the specialty lab field and want to know more about it. So here's where we're headed today. We're going to talk about the pain points of ordering labs beyond just maybe a blood test. How does the process of lab ordering affect practices? At Rupa, we're all about education, not only education around how to read a lab and what to do with it, but also how to make your practice more efficient and business savvy. So we are here to help on that. How do practitioners order and manage labs? It's quite the gamut that we have heard of how they track and follow up with or set reminders for their labs. Building the future of lab work, which of course is what Rupa is really, really here for. And then we're going to do a Rupa Health demo, and I will show you a new look into our Rupa University that has launched very, very recently. So I have been a practitioner, I've been a doctor for 17 years, and I am completely aware of the not so fun part about ordering lab work. I was lucky enough to have a full-time medical assistant whose only job was to handle lab ordering, requisition forms, following up, finding out, did the patient do the test? Are they not going to do the test? Did they pay for the test? And that can take a lot of time. It can be very expensive. Like I said, I was lucky enough to have somebody, but not everybody does. So when you are working with specialty labs, you're looking at 3, 4, 5, 6 different companies. But in fact, on the Rupa platform, we have 30 plus different labs that you can choose from. And if you want to have an account with all of them, you can, but that's a lot of cats that you're going to have to herd. So as a practitioner, getting into and out of and creating all of these portals is a pain. Handling payments for labs, it's again, tracking with patients. Did you pay for the lab? Did you send that in? Remember to do your credit card? Are you paying for the lab as the practitioner? Maybe you have some sort of course or bundle pricing that you're doing. And so it can always be very sticky around who is handling payments and did it get paid on time. Tracking results as they come in from different labs. As we know, as I said, imagine just one patient and you've ordered 3 different labs on. Maybe you've ordered blood work, maybe you've ordered a stool test, maybe you've ordered some sort of urine test or a saliva test or a genetic test. But again, now you have to track where all those labs are. When did they get shipped out? When did they get collected? You have to get in and out of all of the portals and trying to follow up and manage this patient. Coordinating phlebotomy, especially for those of you in virtual practices. If you have a telemedicine practice, you're seeing patients or clients from all over the United States. And maybe if you even have a brick and mortar, you may not be in an area that has like a hospital they can just pop over to and get a blood draw. So trying to coordinate phlebotomy for your patients near and far can be really, really tricky and really lower patient compliance. If they can't get their blood drawn, then of course they're not going to get their labs drawn. Patient support. Your job as the practitioner is to see the patients, to help the patients. It's not your job in an ideal world to have to follow up and answer and be readily available for all the questions that they have. When they have questions about when should they collect their kit, how should they collect their kit? I think they collected their sample wrong. They're not sure where the payment card goes. They're not sure, is the requisition form 2-sided? Do they have to fill out both sides? They collected it wrong. Can they get it canceled? All of these you are probably getting peppered with throughout the day, and you quite honestly don't have time. You're there to help improve patient health. And with this comes all the patient support. And especially if you're a single practitioner, then you don't have the support. You don't have a front desk. You don't have a medical assistant. You don't have a nurse. You don't have somebody who is there to field all of these questions come in. And remember, these patients, as you know, they don't feel well. They don't feel well, so their brain isn't functioning that well. So you keep getting the same questions around lab work over and over and over again. And finally, how can I possibly learn about all of these tests? When I started at Rupa, my very best friend who's been practicing just as long as I have said to me, you know, I'm really excited you moved to Rupa because now I'm going to get the exposure to all these labs that I don't know anything about. As I said, Rupa has 30 plus labs on their platform, and it's really difficult unless you are really out there at the conferences and in webinars, keeping up to date on all the different labs. And she said to me, I'm really glad it's going to be one-stop shopping. So you can just tell me, I have the labs that I really like and I've used for years, but I know there are new cool labs out there. I know there are labs I'd like to expand into, and I just don't know them. I just don't know about them. Or even if you're used to using a particular lab, but you're looking to switch or add on additional markers, you may not realize those additional markers exist. And so to be able to have that all on one platform, she was thrilled for me, and you will be too. All right, so the current way most practitioners are ordering labs. As I said, like when I was in practice back in the day, I had a lab account with every single lab that I ordered, which meant I had a portal that I would log into and out of for my patients. And I would have to go into, or have my assistant go into every single day and download the latest labs so that we could either upload them into our EMR or figure out who hadn't collected their labs yet, who was still in processing, and figure out a system. So sometimes you're lucky enough that you have an EMR or EHR that imports the results, and that does help. It absolutely makes a big difference. But some of you, because I talk with you, some of you are working out some sort of Excel spreadsheet or Google spreadsheet where you are naming out your patients, what tests they're doing, the date, if they're doing it, and then working that way. Or you've got some sort of card system that you use, especially for things like reminders. Reminder, you need a thyroid test in six weeks, or reminder, I'd like you to repeat this stool test in 6 months or a year, or whatever it is. A cortisol test, I want you to repeat this cortisol test in 4 months. Sometimes you can do it in EMR, which is amazing and great. And some of you are like, oh, I'm really like to write things down. And so I've got this sort of card, Excel, Google system that I am trying to get it all connected and linked together. And then the rest of you, you're like, I don't have a tracking system. It's just me. I haven't figured out the tracking system yet. I didn't know I was supposed to have a tracking system. This is new to me, but it's something that I've been wanting. And so you actually don't know where your patient's labs are. You don't know which labs are in or are out or in processing. And so you kind of run the gamut between your EMR is helping to an Excel spreadsheet to, no, we're just hoping for the best. I hope my patient compliance is good. But remember, as I said, we're dealing with sick patients who don't feel well. So we know their brain isn't working well, and it's going to take a lot of your time. So that brings us to Rupa. Rupa is here to build the future of lab work. Our whole goal is to make your life easier as a practitioner. How do you order and manage your lab work all in one place? A place to learn and grow, provide a drastically better experience for your patient. And your patients have really come to expect that, like A+ customer service in 2022. And so we're here to help provide that. And as I said before, run a more efficient, profitable clinic that enables you to spend more time with your patients. Not only do we want to help you get educated and learn about these labs, not only do we want to help take it off your plate, so that the patients aren't constantly pestering you with questions. Not only do we make it easier for you to have just one platform that you have to log into, that's it. But we really, truly do want to give you the most time back that we can so that you can do what you do best, which is help patients heal. So we were going to help you on the practice management side so you can go out into the world and make it a better place, because goodness knows we need a lot more boots on the ground people making this a better place with our healthcare. So with that, let's back up. Let's dive into a demo so I can show you how easy it is. So first I'm going to show you in just a couple clicks. We're going to switch screens here. Boom. So when you have a Rupa account, you're going to log in and you will go to your dashboard. So this is what your dashboard looks like. And this is going to have all of your patients listed out, and you will see their status: in progress, draft, all results are in, awaiting shipment, etc. But you need to know, Carrie, how fast is it to order lab work? So you're going to click in the upper right-hand corner. It's going to say start an order. And you're going to enter your patient's name. We actually only need 3 pieces of data from you to get this going. I need their first name, I need their last name, and I need their email. If they're new to the system, then when I type in a name, so I'm going to type in, for example, Sam. So I already have my patient are in here, and obviously it's a made up patient for HIPAA compliance. So Sam Brady. Now, if Sam was new, I would type in Sam, and then it would just have me enter it into the system. It's very easy. So I click on Sam Brady. Sam Brady needs lab work. So the way that it's divided out is at the top, you'll see your bundles. You have a bundle section. You create that. Do you have the same kind of bundle that you order on everyone? If you have a fertility bundle, if you have a hormone bundle, if you have a first patient bundle, if you have a men's health bundle, if you have an environmental toxin type of workup and bundle, or a viral bundle that you do, you have the ability to create in the settings all the bundles that you use. So it's one click to add it. Underneath that is your favorite section. Any lab that you use all the time, but you don't necessarily want in a bundle, or maybe it is, but you just want the ability to click really quickly. So for example, I have uric acid hearted here as a favorite. I may not use uric acid in all of my patients, but I do use it enough that when I need to add it, I can just right there click it if I wanted it for Sam. And if you scroll down, this is where we get into all of the labs. So you can actually search by category. So if you're like, there's this autoimmune test that I learned about, I'm not entirely sure what it was called, but I'd really like to run it. You would just go down to the autoimmune category and they would all populate. Same for lab company. If you're like, oh my gosh, there's that test that's run by Genova, you could scroll down to Genova and you would see all the lab tests that Genova has to offer. And we have an extremely smart search bar right there. So you can search, again, test category, or company, the lab company of what's going on, and you will get smart options that will come up for you. But if that's not exactly what you're looking for, you could keep typing it out and see. So if I was looking for an adrenal profile or adrenal stress panel, then I would just click that. Now, in this example, let's pretend Sam needs a Dutch test. So I'm going to click add to cart. Sam also thinks he lives in a moldy home and he would like to be tested for mold and mycotoxins. I will skip over GI map and I will click on the mycotoxin panel. On the right-hand side of the page, you will see it says Sam's practitioner, which would be you. the mycotoxin, the Dutch complete, the total. And if that's all you needed for your patient, you would scroll down and click send to patient. In this little section that has a generic email listed, that's where Sam's email would go. Remember I said all you need is a first name, a last name, and an email, and we will handle the rest. So it's click, enter in their name, their email, click the test that you want, and hit send to patient. It's that fast. So for those of you who've been ordering lab work for a while, filling out requisition forms, filling out actual forms, having to log into and out of different portals to drop ship, having an assistant log into and out of portals, ordering, requesting drop ships. Again, if this was for the Dutch test and for the mycotoxin test, and you were doing it traditionally, you would have to log into Precision Analytical and do order the drop ship, and then you would have to log into Great Plains and order the drop ship for one patient. With here on Rupa, it's just a couple clicks and we can send a patient. Now, I'm going to expand a little bit just to show you what else is possible and to talk about pricing. So as I said, practice management is a big goal of ours. We want to help you do what you do better. So if you have a patient where you need to schedule out, like let's say Sam needs to repeat this in a year, you have a whole year-long protocol with him, you would just switch to May 2023, and this will be in. Same for things like thyroid. If you have somebody you're doing thyroid draws on or hormones on or whatever it is, then looking at pricing, you will see that we do give you the practitioner pricing. So if you're used to drawing or collecting mycotoxin tests, we give you the practitioner pricing there, $249. The Dutch complete 2 practitioners is $250. Rupa offers the same pricing there, 2 practitioners. Majority of our practitioners want the patient to pay, and I will show you in just a second what that looks like when the patient sees it. But let's say you prefer to pay for the lab work. Let's say you have some sort of class or course or package deal. It's one price that includes so many visits and so many tests in a package deal. So the patient would pay you as part of the package, and you want to pay for their order. You would just click that button that says, I will pay for Sam's order. And then you would enter either add a bank account if you roll it that way, or add a new card. Of course, you can always have a card in here that we would just always use, and then you would pay for Sam's order. Now, of course, if you do have an assistant or an office manager or somebody, a nurse that works with you, could they get in here and do this for you? 100%. I'm just letting you know as the practitioner who's watching what you can do. Now, let's go back. Speaking of price, let's go back to pricing. So a lot of times people want to know, how does Rupa charge to handle all this? It is a flat 7% fee on the order. So it's a processing and ordering fee. In this example, the 2 tests together are $698. The 7% fee is $34.93. So that would either get passed along to your patient directly if they're paying for it, or if you are paying for it, then you would pay that as part of ordering the lab tests. And then, of course, if you have a package deal or a bundle, you would just include that into the pricing back to the patient. So the 7% is what we collect so that we handle all the back end stuff. We will handle the shipping of the test from the lab, how to fill out requisition forms, following up, all so this one place on one portal. And I'll show you that in just 1 second. So it is just a 7% processing and ordering fee. Now, the last thing I want to show you over here, because we do get this question, I remember when I was in practice having this, if there are any notes you need to add to the patient, feel free to enter them here. Let's say you're running a hormone test and you're like, hey, remember, collect 5 to 7 days after ovulation. Or let's say it's a stool test and you're like, remember, stop your probiotics, or whatever you're going to add to the patient. You've told them in the visit, but again, sometimes patients don't always remember. These are humans we're working with who don't feel good. So you can add those notes here. And in our settings section, you can actually include snippets. So if you say the probiotic thing every single time, you can save the snippet as probiotic and it will auto-populate the sentence. Any notes to Rupa you can put there. And if you use ICD-10 codes, you can enter them there. Now, Rupa does not, for the most part, bill insurance. But if you would like us help with us with generating a super bill, if your patient's paying HSA, FSA, oftentimes needing ICD-10 codes, it is a searchable database. So if you are, let's say, fatigued, you don't remember what the ICD-10 code is, you can enter it in and poof, it will show up and then you can enter it. So that is how simple it is to order different tests from different companies. You could even add a whole lot more on here. I'm just showing you 2 companies, but if you were like, I have like, I mean, my standard new patient for somebody who's very ill might be 6 or 7 companies. Not a problem. You can order everything on here as long as we have their first, last name and email, submit order. So now what I want to do is I want to show you what it looks like for your patients. What does it look like for your patients? What are they getting, of course? So think of us like an extension of your team. We are here to handle all of the back end to make your life easier. So first and foremost, when the doctor places an order, your patient is going to get an email from us within 24 hours of payment. We will have contacted the lab. The lab is going to ship out the kit. It's a drop ship system. 2 days after the kit ships, we are going to send instructions to your patient. Even though there's going to be collection instructions in the kit, we are still here to help them. And even a lot of times we have instructions that we have curated that can make it just that much easier. Sometimes, as you know, we read these instructions on how to collect, a stool test or a urine test, and it maybe is more confusing. And again, if somebody doesn't feel well, trying to read these instructions can be really hard. So we have testing instructions that can help make it easier for them. 2 weeks into the process, we check in with the patient to see how it's going. Are you going to collect the test? Have you already collected the test? Or are you not planning to collect the test? Because we would like to let you know that as the practitioner. And when the results are in, we do let you know. So here's the first and foremost. Patients get an email from us, and this is what it looks like. So when the patient pays, they're going to get an email that looks on the left side. Hello, Joshua. Dr. Jordan Stern has ordered lab testing for you. They will click the blue button that says view tests and pay. And when they do so, it will look like the form on the right. And so we will collect their address, their phone number. We will collect their payment information, et cetera, et cetera. Now, if you are paying for the test, let's say you have some sort of class or course or bundle thing for patients, don't worry, we don't collect payment, but we still need their address, their phone number, et cetera. And so again, hi, Jordan, you have a lab placed for you. You click the button for your shipping details. The patient will open it, enter in their shipping details. We will make sure that that is drop shipped right to them. So no matter what, we try to keep it as streamlined and easy as possible. Then, like I said, within 24 hours of payment, we notify the patient that the order has been shipped. So they're going to get an email from us letting us know, in this example, like the mycotoxin, your lab has been sent. It is the mycotoxin test, and we have sent your test to the following address. Then we send cheat sheets and instructions. Now, what do I mean by cheat sheets? Well, like I said, in some cases, our instructions are maybe much more user-friendly for some of our patients, especially when they don't feel well and they're trying to figure out, I don't know how to collect this stool test. The instructions are really confusing, or this urine test, it seems really complicated. So we try to make it as simple for them as possible. We help them fill out the requisition form by giving them examples. It's amazing to me the number of patients, and you know it because you're in practice too, the number of patients who really struggle with the requisition form. They don't understand that maybe some of them are two-sided. The print is really small. They're not exactly sure what the questions are looking for. They don't know what an LMP is, last menstrual period, of course, or date of last menses. They're not sure because they were kind of bleeding, but kind of spotting, what does that count? So we try to help them through that. And finally, if you've ordered a test for them that requires a blood draw, step 3, we do try to help them find phlebotomy. If you have a phlebotomist that you prefer to use, I know that some of you, especially if you're brick and mortar, or been practicing in your city for a long time and you have a lot of patients from your city, even if you're doing telemedicine, you have a favorite phlebotomist, and you can 100% enter that phlebotomist in as the phlebotomist that will see your patients each and every time. But if not, don't worry, we've got you covered. We have an entire map that they can enter in their zip code or their address, and we will find a phlebotomist or phlebotomy station that is close to them, and they can get their blood drawn. Now, I know that some of you offer phlebotomy service in your clinic. Can you enter in your clinic as a phlebotomy service if you already have that set up? You can, and we do have that. So again, if you're been in your city a long time and you've got the ability, you have a phlebotomist who maybe comes in 2 or 3 days a week to handle blood draws, you would just enter that in as part of phlebotomy to let your patient know. We send them resources, as I said, as it comes to phlebotomies, to make it as easy as possible, filling out the requisition form, giving them examples, and checking to see how the sample collection is going. So if they've completed the test, they will just click, I've completed my test. I'm planning on completing my test, or I don't plan on completing my test. So even if they've completed some, but not all, they can still click the I'm planning on completing my test because they're not completed quite yet. And lastly, when the results are in, we notify you as the ordering practitioner, hey, your results are in. So you can see, great news, a result of your patient has come in. Now, in this example, there's a precision analytical test, results are in, a Genova test, results are in, but Great Plains are not quite in yet. So now you can see based on this, as the results start to roll in, what you're waiting for. So you don't have to go digging through different portals, remembering passwords and trying to figure out which of the labs you ordered and what is ready to go over for your patient at their next visit. And so this is a great for, again, business streamlining, business practice to see, okay, we're just waiting for the Great Plains. And you can even check in because a lot of times your patient will schedule a follow-up so that they are going over these lab results, their follow-up. And you can even check in with them to go, okay, I see that you're missing the Great Plains yet, or you have one more test out. And we can, and I'll show you, actually, I'll just show you because that'll make it easier. Where are they in the process? So here is an example. We're back in the dashboard. We're back in your dashboard, my generic example. And so you can see down the middle where it says status. So I have me as my own patient in progress. I am in progress. Jade Jordan, all results are in. Sam Brady is in progress. Eric Paul is awaiting shipment. What does that mean? Awaiting shipment means awaiting shipment from the lab. It's waiting to be drop shipped. So you can actually see at the various level. So for example, me, kit shipped to patient. You can get real-time information about your patient and where the labs are. Jade had an ELISA ACT test run. All results are in. So if Jade has a follow-up appointment, you can rest assured, you feel free to go over the results. If Jade doesn't have a follow-up appointment, then you can reach out to Jade and let Jade know, hey, your results are in. Let's go ahead and go over that. As an example, Eric Paul awaiting shipment, invoice paid, which means we're just waiting on the labs to drop ship the kit. And in the last example I want to show you is the pending payment. So Caroline Johnson has a GI map and a Dutch test and pending patient payment. So you have sent the order in. We're just waiting for Caroline to pay. Once she does, then she will move into the waiting for the lab to ship. Once that happens, we will just move on down the line. So using this portal, you can also search. You can search by name of your patient. If you are like, oh my gosh, I wonder if that patient did the lab test. I haven't heard from that patient in a while. You can just search because, eventually this list is going to get really long with all of your patients. You can also, you can search by filter. So if you're like, who has all results in? And at this time, only Jade does. So you're going to make sure that Jade has a follow-up appointment on the books so that you can go over them. Who is in progress? Who do I need to follow up with as a practitioner? Who's maybe an appointment I need to bump out, or who's really close? Like, okay, Carrie's not on the books yet. She's in progress. I'm going to go ahead and schedule her for a couple of weeks because I know the test is in progress at the lab. And I should have those back. So it does make it easier for you in one platform to figure these things out to run your practice better. Again, our whole goal is to streamline it and make it easier for you. Now, one of the things I do want to show you is I'll show you how we get into education as well. But just quickly, just to show you on the settings section. So on the settings sections, you can change to your preference. So you can release results automatically. You'll have coupons in there. Here's where your custom test bundles are. So you can add, if you've got a fertility bundle, a men's health bundle, a environmental toxicant type screening that you do, or a chronic virus or autoimmune type screening, you will create the bundle, add everything in there, and then it's literally one click. It makes it so much faster. Underneath are your save notes to patients. These are where your snippets are. If you say stop probiotics to freaking everybody when you do your stool testing, create a snippet, and that way, instead of explaining about stopping probiotic every time, you would just do the snippet. Same for hormone testing. If you're telling your patients, even though it's in the instructions, even though we're going to help remind them, sometimes it's nice just to have the note from you to say, remember to collect in the luteal phase, or collect 5 to 7 days after ovulation, or collect whenever. You can save that snippet. Team members, if you want to invite a team member, you can do it there. And then the phlebotomy is here, the Phlebotomy Network. And the reason I really like this is if you have a preferred phlebotomist that you would like to add, so it's included every time, you will click the add a preferred phlebotomist button. You will add in your phlebotomist all their information, save it, and that way every time you can that'll just populate and for your patient, and then they can just use that phlebotomist and make it that much easier. Now, we've talked about your experience on Rupa. Our whole goal is to streamline it so that you can do what you do best. And we've talked about the patient experience because we want to make it as smooth and easy for them because they don't feel good. That's why they're coming to see you, and they want to make sure they get these labs right. They're trying to make sure they get these labs right. And so we want to be there to hold their hand, answer questions, get the kit sent out, make sure that they understand they have to fill out the requisition form, not just half of it, but the whole thing, covering examples of how to collect certain tests. But then the third pillar is education. So now you've done the test. Maybe you're new to the test. It's only your second or third time doing the test, or you're new to functional medicine. Where do you get the education around these labs? So we are very proud to announce we have Rupa University. So Rupa University is where you're at right now. All of our live classes are through Rupa University. You can check us out at rupauniversity.com, and you can see to learn about specialty lab testing from industry experts. With this, our live classes, we have it tagged. So if there's a particular type of live class you would like to see, let's say PCOS, you can search PCOS and look at that. There's already some live classes in there. Your PCOS toolbox, the functional approach, how to use the Dutch test for PCOS, to give you examples of how you can learn about a particular subject, cardiovascular disease, detoxification. Or let's say you just want to know, like, I'd like to just scroll through. What does Rupa have going on? We have our upcoming right here with Dr. Jaquel Patterson, all about Lyme 101. I'm super excited. Dr. Jaquel is one of my favorites when it comes to Lyme and Lyme education. And then you can just scroll back through here and see who our speakers have been, what the topics are, and feel free to watch at your leisure. These are all 100% free and here for you. Then if you're looking to dive deeper, we have boot camps. Boot camps are new to Rupa. We are doing 6-week programs. They are paid. They are around a lab and they are tactical. What do I mean by tactical? So we are going to take whatever lab it is. The upcoming boot camp we have happens to be mine. It's connecting the dots on female hormones from PMS to PCOS using the Dutch complete test. What this is over 6 weeks, we're going to give you the basics of a lot of information pre-recorded on hormones. And we're going to tactically go through the Dutch test to understand how to go through it from start to finish and different ways you can address these hormones, whether it's conventionally or whether it's with a functional medicine approach. So if you are newer to this test or you just want more experience with this test in particular, you can pay and join the boot camp and learn all about it and what to do. So while you will get some high-level information around hormones, our goal is really to have you prepared on Monday morning to utilize a Dutch test and go forward with your patients so that you can help them and know what to do. Now, this example of the boot camp, which feel free to sign up, you can, it's open now. We are planning to do for a lot of our labs. So we're planning to hit autoimmune, we're planning to hit cardiovascular disease, we're planning to hit men's health, fertility. We're really trying to cover a lot of information and around a lot of different tests from a lot of different areas. Not everybody uses the same labs. We have 30+ labs on our platform, which means we are covering a wide variety of conditions, symptoms, diseases, and we want to make sure that you feel practically and tactically ready to approach them on Monday when you start seeing your patients. So I greatly appreciate your time and attendance. I hope you now understand through this masterclass how easy it is to sign up with Rupa, to order a test. We just need your first, your last, and the email of your patient. Click, 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 send a patient, and you're done. The patient experience is phenomenal. We're here to hold their hand through the whole way so that you can continue to do what you do best, which is see patients and help them. And then we are here to support you with education as well through the new launch of Rupa University. So again, thank you so much for watching. I'm Dr. Carrie Jones, Head of Medical Education here at Rupa, and I'm happy to answer any questions if any questions have come in.
Yes, Carrie, that was awesome.
Yeah. Yes. I love it.
Thank you so much for taking the time to put this presentation together and go through it so thoroughly. We did have a number of questions coming in, so let's just jump right in.
Please.
The first question that we have is, can any practitioner join Rupa?
So right now, any practitioner cannot join Rupa. So to join Rupa, you have to have lab ordering rights. You have to have an NPI number. So if you're already ordering labs from a number of these specialty lab companies, it's not generally a problem. But Rupa really wants to make it accessible to all practitioners, all forms of practitioners. So stay tuned, because we are hoping to expand our ability to allow all healthcare practitioners to order on the Rupa platform. So cross your fingers. If you are not yet on our wait list, there's a link, correct, Adrian? Believe
I'll drop that.
Perfect. He'll drop that in the chat. There is a link where you as a practitioner can sign up and be the first to know when this launches, so you can take advantage of it. The other thing about can any practitioner is not every practitioner can order in every test from every company, or maybe in every state. And so this ability will also hopefully expand that for you. If you know your particular designation, you're not allowed to order from a particular company for whatever reason, we're hoping that by having this expansion, then you will be able to order from all the 30+ labs that we have available on our platform. But we do know it is something we are actively working on.
Awesome. And just to expand upon that, right now, Rupa also only operates within the US. Well, how do I get a little more specific on that? Only operates for patients located within the US. So as long as your patient's located within the US in 47 of the 50 states, those other 3 states, unfortunately, being New York, New Jersey, and Rhode Island, we can work with you. So the next question we have here, and just to provide some context, Carrie and I might be tag teaming this Q&A a little bit. So the next question we have here is which EMRs, EHRs does Rupa integrate with?
Oh, we just launched with Practice Better. We also integrate with OptiMantra and with Serbo. And we have had a survey going out all the time that where practitioners can enter in the EMR that they use or they would like us to integrate with. We are keeping a list, so our engineers are aware, and we can hopefully continue to expand and add to those 3.
Yeah, absolutely. The EHR integrations are something that we're super excited about. We know it makes everybody's life easier, and so our engineering team is working on that. So I think Jane, Charm, as well as a couple others are on the short list, but keep an eye out over the next year. That's going to be a really big initiative for our team not just next year, but just moving forward in general. The next question we have is, how does this bootcamp differ than what Precision Analytics offers on their site?
Yeah, so I can answer that because I used to work there. So everything on the Dutch website is free. So they do have monthly webinars. You are 100% more than welcome to watch their monthly webinars as well. Dutch does not offer boot camps though. So they don't have any kind of deep dive with the ability to ask questions, live Q&A, formal setup yet. So they do have, for practitioners, they do have consultations. They do have all of the videos available on their website, but they don't actually have it packaged into a bootcamp situation. So we are just taking it one step further. So we're taking a lot of the information, obviously, that we have learned from them and got from them, and then incorporating that into our bootcamp. The one thing I didn't mention in the current Dutch bootcamp, and the only reason I didn't mention it is because we plan to have a lot of boot camps, and I don't know that I can promise this for all of them, but a Dutch complete test is included in the cost of this boot camp. So the boot camp that I'm doing, you will get a free Dutch complete to run on yourself. It's for self-orders only. Again, you still have to meet all the criteria. You have to have a Rupa account. You have to have an NPI number and be able to order Dutch testing. Again, unfortunately, New York, New Jersey, Rhode Island is excluded. Those states, man, especially New York, they're so strict around lab stuff. But in this bootcamp, you will be able to run a Dutch complete. In future bootcamps, that is 100% our goal, is that no matter what bootcamp you're taking over what lab, you will be able to experience it firsthand. I can't quite promise that yet, but I can with the Dutch one.
Perfect. The next question we have is more of a comment from Deanna. These boot camps sound great. I hope we get to do one on psoriasis.
Yes, skin conditions. It is on my list. Absolutely. Absolutely. And actually, if you have suggestions, we are a blank slate and open to everything. So if you actually want to write university@rupahealth.com, that's university@rupahealth.com, with suggestions, I would like to see this topic. I would like to see this lab. I would like to see this educator. We are here for it. Our whole goal is to meet your needs. We are not pushing an agenda, our own agenda. We're here to make your life easier. So university@rupahealth.com. Give us your feedback on what you would like to see, and we will add it to the list.
100%. Yeah. And like that's perfect. We've built so much of this platform based on the feedback of what our practitioners tell us. And so, what y'all want to see, we really do listen to it. That is actual human beings. And so if you provide us some feedback, we're here to listen to it.
And that applies to everything, I would say, right? Like just as Adrian said, if you've been using Rupa and you have feedback, we 100% want to hear it. We have made a lot of changes over the last several months based on feedback we've gotten from users like you. So we're here for it. Again, everything from the EHR that you use, the education you see, we want to know because we want to meet your needs.
Exactly that. And you can even see that share feedback button on the side of the menu bar. Just hop right in there and you can let us know.
Yes.
The next question we have is, suppose the patient, over one. Let's see here. As a new practitioner who's currently looking and doing blood work for patients, are you saying that patients would have to submit everything on their own to their insurance companies for blood work for standard tests through, for example, Genova labs?
I'm trying to see if I make sure I understand the statements correctly. So Genova independently as a company will bill insurance. Genova through Rupa will not bill insurance. So if you're ordering Genova testing that can be billed through insurance on the Rupa platform, then we cannot bill insurance on behalf, or Genova will not bill insurance on behalf of your patient. If having your patient submit a super bill, then obviously including the ICD-10, we help generate with that. But we don't bill insurance, and specifically with Genova, since you mentioned Genova insurance will not bill through the Rupa platform as a third party. I will say, as a practitioner who's been in the industry a long time and has worked with Genova a lot, I'll be curious to see how long Genova continues to offer the insurance idea, because I've been using Genova 17 years, and it has changed drastically through the years, and it is continuing to change. So it's a great option. It's so convenient and wonderful for patients. I don't know how much longer Genova is going to have that option for people in the insurance industry. But you are correct. We do not bill Genova insurance, and Genova will not bill through the Rupa platform. Yeah,
and even to expand upon that, just hopefully, down the line, insurance will accept all of these tests, right? But nobody really understands, in my opinion, actually how insurance brains operate. So we'll see what the future has to hold with us. And then just even, expanding upon that a little bit more, when we talk about real standard tests like the Quest and the LabCorps out there, right? They tend to accept insurance. And if that's a route that you want to go, by all means, we are looking to adding them eventually onto our platform as well. But for the time being, if, insurance is a really important component to your business that you're looking to build out, continue to have those direct relationships with the Quest or the LabCorps if that's how you want to go. The next question we have here is, who receives the lab results and who has control over how they're sent to the patient? You do, 100%. The ordering practitioner only has control of the lab results. The only would be is if you invited somebody from your team to have, so if you have an office manager or a nurse or medical assistant or somebody else, a resident that you're working with, and you invite them through the settings section to have access, you're the only one who gets them as the ordering practitioner. If you want to send them to patients, then you are more than welcome to send them to patients or right from the portal, or you can wait until you have the visit with them and then you can send it to them. But you have complete control from start to finish. Yep.
And patients can't order. I should say this as well. Patients also cannot submit orders onto Rupa. So a patient of yours cannot just see a video on Instagram and be like, I want that test, and order on Rupa. They can only go through an ordering practitioner.
Yep, absolutely. And that actually lead me to a question that was asked previously in the chat was, does Rupa interface directly with, websites of practitioners? We can to an extent, right? But because of what Dr. Jones just mentioned in that patients can't order directly from Rupa. So for example, if you're a practitioner who has, your platform and your website and you list all the different tests that you offer, you're still more than welcome to do that, but the patients wouldn't have the ability to order the test directly from Rupa, as you need to be a licensed practitioner. So just to kind of expand upon that as an opportunity, I know that one of the practitioners in the chat had that question.
Yeah.
And then the last question we have here is can patients get their blood drawn at places like Quest or LabCorp?
So let me say, so Quest or LabCorp directly sometimes are independently owned or independently a representative of Quest or LabCorp. So I'll give you an example. That I have a lab draw station that's like not far from my house. It has the LabCorp logo out front, but I have gotten other labs drawn there that are not LabCorp or Quest for that matter. So some of these lab draw stations, 100%, they represent as LabCorp, but they're not actually owned by LabCorp. And so they can, if they're allowed, if they have the ability, they can draw some of these lab tests. So we have that in our phlebotomy. In those options, you may see some of them might be a quote Quest or LabCorp center, but really they're an independent company that just promotes the fact that they have a contract with LabCorp, but they also have the ability to order for other people as well. Not all. We do know there are true 100% Quest LabCorp draw centers, and they may not step outside their bounds and may only stick with Quest lab orders or LabCorp orders, but the independents, if they're on our phlebotomy list, can.
Perfect. Yeah. And so to check that, you can just hop right into your settings. There's a full phlebotomy section. You can search by zip code. Additionally, you can reach out to our team if there's no options within your area to see, have our team do a search. But, with everyone's favorite answer, it kind of depends. It depends on the location. But if you want us to reach out, we're more than happy to reach out and vet those locations for you on your behalf. But those are all the questions we have. Carrie, any final?
Wonderful. No, like we've been saying all along, our whole goal is to meet your needs. So we love feedback. We want to hear from you. We want to hear how to make the process better. We want to hear how we can help you do your job better. We want to help understand how to educate you better. So we want to hear from you. We are a chatty bunch, and we hope you are too.
Absolutely. And with that, if you do have any questions, I'm going to go ahead and share my information. Feel free to reach out directly to me. I'm more than happy to hop on a call and answer any questions that you might have. And if you are interested in setting up some time with me, I'm more than happy to hop on. So with that, again, my name is Adrian Martinez. Thank you so much for joining us this afternoon. And I hope you enjoy the rest of your Wednesday. Take care.
Bye-bye.
Bye.